Hello and welcome to Tuesday Talk, Project Open's weekly series aimed at bringing the topics of addiction, recovery, treatment, and any other topic related to substance use disorder to the forefront of local conversations. Today, we're very excited to have with us members from Whiteside County Health Department and the Whiteside County Community Health Clinic. This is a health department in Whiteside County which services a number of populations. They have a federally qualified healthcare center as an extension of the health department, which is able to provide unique services. And they have very innovative models for helping people with substance use disorder. Today with us, we have got Whitney Miller and Dr. Smith. Whitney and Dr. Smith, if you wouldn't mind, could you please introduce yourselves and kind of give us a little bit of background and some work experience?
Sure. My name is Dr. Smith. I've been here at the Whiteside County Health Department for over 5 years, which also means that I have been with the medication-assisted treatment program here for that length of time as well. Previous to that, I have worked in Whiteside County as well as Clinton, Iowa, in different facilities providing family practice is my background.
Thank you. Whitney?
Good morning. So as Aaqil mentioned, my name is Whitney Miller. I'm a licensed clinical social worker, and I've been here with the Whiteside County Community Health Clinic for the last 6.5 years. And I've been working in this field for almost 13 years total. I've worked with a wide variety of patient populations from early childhood, adolescents, and adults. And those I've also worked in, I've done crisis work, medical social work, done some parenting, skill classes, very familiar with trauma, and now, of course, substance use disorder.
Awesome. Well, thank you so much for being here. And I know we do have a special guest that'll join us a little bit later in the talk. But we'll let the anticipation and suspense build for that. So when I first came back to the area, I heard about the Whiteside County Health Department, but then I also heard about the Community Health Clinic. Can you give a little background as to what are they, how are they different, how are they same, and how do they benefit the patient of the community?
Sure. So the Whiteside County Community Health Department is located in Rock Falls, as Aaqil had said, and was established in 1966. We expanded in 2006 into a federally qualified health center, which means that we have a full medical, dental, and behavioral health clinics. We actually employ over 200 individuals. And we serve patients from all over. So it's not just for residents in Whiteside County. We see patients from Rockford, the Quad City area, Princeton, Freeport, all over. And we accept all forms of payment for services, including Medicare, Medicaid, private insurance, and also self-pay. We do not discriminate for the inability to pay. We will make sure that we're serving any patient who walks through our door, which makes us pretty unique and special.
And I got to ask you a question about the barn over here. Is this the original building maybe, or is this just a barn in town?
I think it's a random barn in town.
Awesome. And so, today's topic, we're obviously focusing on treatment and recovery. Project Open operates in 3 primary domains: prevention, treatment, and recovery. And today we're going to be talking more about the MAT program. But I think before we get into the MAT program and why that even came to be about, it might be important to talk about the opioid epidemic as a larger whole and maybe what that played into the need for MAT. So, Dr. Smith or Whitney, would you guys mind giving your summary on the opioid epidemic?
Sure, I'll start, and if Whitney has anything to add, that would be great. So basically, what we're looking at in general, so opioids, for people who are not familiar with them, those are substances either man-made or opium actually comes from a poppy plant. They act on a receptor in your brain, and they're intended for pain relief, but they can also have different side effects, such as decreased respirations, constipation, nausea, confusion, drowsiness. So, when we intend to do good things sometimes with medication, obviously sometimes some other things happen. One of the other issues with opioids is they can be very addicting, meaning that people develop a tolerance over time if they're on them for long periods. and then they become dependent, meaning that if you stop taking them, you'll actually have symptoms from that. So sometimes people will continue to use these medications even though they aren't having pain or what their initial use was for. And that can cause some issues sometimes, within the family, financially, and things of that nature.
Yeah, and I just wanted to add, I think, we see this often, Dr. Smith, is when it gets to the point of dependence, that the individual may still feel like they have some pain, but it's really psychological because of the way that the opioids work in the brain. And it increases mental health symptoms such as depression, anxiety. It might be triggering for trauma from past experience and so forth. A stat that I ran across the other day was that in January 2020, the CDC reported almost 3,000 drug overdoses in Illinois. And by January 2021, we saw a 23.7% increase in overdose deaths, where previously, for a short period of time, I believe it was 2018, 2019, for the first time ever, we had not seen an increase in overdose deaths. And unfortunately, I believe that the implications from COVID, people being at home, isolating, have increased that.
Yeah, I think that's very true, Whitney. In fact, I know what you said is correct. In 2018, we did not have that increase, which was nice. But yes, 2019 to 2020, we had a little increase. Then again, from 2020 to 2021, there was a much larger increase. And drug overdose is the leading cause of injury-related deaths in the United States as of right now.
Yeah, and so thanks for that background over there, and that is very important as we look at Project Open, which is our tri-county grant addressing substance use disorder and more, the opioid use disorder. We did notice that when we started in 2018, there was a jump, there was a lot of activity going on, but in 2019 it started to look like we were heading in a good direction. But then the pandemic, stay-at-home orders, people possibly being in environments that maybe unsupportive to healthier behaviors and supporting recovery. It was definitely an unfortunate storm, which is why our topic today about conquering recovery through MAT is very important. And so, starting at the very high level, what is MAT, guys?
Sure. So MAT is medication assisted treatment, and actually most recently some individuals are calling it MAR, medication assisted recovery. So either one, same thing if you hear those acronyms, but it's the use of medications in combination with intensive therapeutic services to treat substance use disorder and prevent opioid overdose deaths. MAT is so important because, just like cancer or other medical conditions, you have many forms of treatment, many options of treatment. You can be referred to bigger cities, and it should be the same way for substance use disorder as well. People should have options. And so MAT is yet just an additional resource for those who may not be able to attend a traditional detox setting or 28-day program, or sometimes our patients have gone into treatment and they've done intensive outpatient, and it just has left a bad taste in their mouth. They've had a bad experience, or maybe something traumatic happened during this time, so they're not willing to go back, and MAT is an additional option for them to seek out. I'd also like to mention that not one size fits all. We have patients who are working full time. We have patients with children. And sometimes they need to address trauma that's happened in their childhood. And so MAT could be an option for them.
Yeah, and I think, in general, sometimes medication-assisted treatment or medication-assisted recovery can sometimes be easier for people to find in areas, especially in rural areas. Sometimes it's more difficult in rural areas for people to find, inpatient detox beds or intensive outpatient treatment centers or things of that nature. So I think that's where medication-assisted treatment, especially office-based assisted treatment, became a real key in that puzzle to try and help fit in with all of these other things that we had to try and help overcome what's going on.
Absolutely. And the cool thing about MAT is that, you know, it allows our patients to regain a stable state of mind so that they're able to focus on recovery versus the cravings that they're experiencing or the withdrawal symptoms that they're experiencing. And, you know, the medications also allow, if you're doing it alongside of therapy, they're also addressing those mental health symptoms, or as I had said previously, you know, childhood trauma that they may or may not have experienced.
Yep. Also very true. One of the other benefits of office-based treatment is sometimes you get into those underlying issues, not only mental health, but sometimes medical issues that have caused people to use different substances to try and relieve either pain-related issues or what have you. And being office-based, you can kind of get into some of those a little bit deeper to help them with some of those medical issues too, not just their substance use.
Absolutely.
That you know, kind of makes me think about like the no wrong door, right, to healthcare. You can come in through any avenue, but when you have that holistic program, it allows you to treat the whole person, not necessarily the one given issue. You know, this year I know they made some changes to providers getting into MAT, making it a little bit easier. But prior to this, it seemed like it was quite a difficult process, which leads me to the first thing is, you know, Dr. Smith, what does it take to be able to prescribe MAT? And then more broadly, why did Whiteside County, you know, Community Health Clinic pursue MAT?
Sure.
What were the challenges?
Yeah, so it was more difficult initially years ago to do medication-assisted treatment because of one of the medications that we use is buprenorphine, and that requires some special training in order to be able to prescribe that for substance use. Previously, providers, be it physicians, nurse practitioners, physician assistants, you know, you had to take a course online, you had to take a test, and then do some kind of one-on-one training to kind of get that under your belt. Just because things have gotten a little bit worse now, physicians can actually, providers in general, they can apply for what's called an X waiver, and that is what allows you to prescribe buprenorphine for substance use. To treat up to 30 people in your office. If you start treating more than that, then you do need to go through the training because you're going to run in probably to some more issues. But there is a really good organization that I do some webinars and things to stay current. Providers Clinical Support System. They have a really nice website that can walk people through the training, help them apply. Like I said, there's webinars and stuff up there that help keep people up to date. But buprenorphine is just one of the products. There are other medications out there, such as methadone. There are some methadone clinics out there that, again, help with substance use disorder. And we here at the health department use buprenorphine products, which includes both oral and injectable. And then we also use naltrexone, primarily Vivitrol, which is an injection, but sometimes we do use oral naloxone too to help with alcohol and substance use disorders.
Thank you very much for that background. It appears to be many, many different ways to treat a patient, allowing for a lot of different options, which then bring us to the next question is, you know, who is appropriate for MAT? You mentioned so many different medications, that people come from different backgrounds, different drugs, different habits. So is there I know Whitney said there's no one size fits all, but is there someone who is appropriate, maybe someone who isn't appropriate for MAT?
Sure. I think it depends on what, you know, everybody's clinic is different. Our MAT program, we developed it to fit into our workflow and what we were able to provide. And so, you know, for us, what that looks like is, you know, coming in for an assessment with a mental health professional and finding out if that individual does qualify for MAT based on their diagnoses. So do they meet criteria for opioid use disorder or alcohol use disorder? As Dr. Smith mentioned, we also treat individuals who are struggling with alcohol use disorder. So I don't know, Dr. Smith, if you want to talk a little bit about pain, because that is different than opioid use disorder. And sometimes it's a hard balance to figure out what that individual may need, because MAT might not be appropriate for them. They might need a pain management clinic, which we would then refer elsewhere to.
Right, absolutely. And that's one of the nice things about having them come in and have an assessment. You can get a better overall feel for not only their mental health and use, but also, any kind of medical issues that might be going on. So providers that have their X waiver to prescribe buprenorphine for substance use, we're truly using it for that. For some of those people that may not be appropriate for MAT are those people that do have true serious chronic pain issues that do need, pain management, which is something that's done by pain specialists who are very highly trained in what they do to monitor patients. They provide multiple modalities, not just oral medications, but other things to help patients function daily with their chronic pain and try and live as normal lives as they can. So sometimes we come across those patients, and it's nice that we are able to refer to colleagues in the area that are able to help with pain management in that aspect.
Thanks for that background. And I have to ask a little historical question to understand, because this is definitely, requires an entire philosophy change. It requires an organizational change with getting providers waivered and the clinic set up. Why did Whiteside County Community Health Clinic decide to pursue MAT? What was it? Something in the past? Was it some personal experiences, or was something happening in the community that might have led to this?
So yeah, it was kind of a combination of all those things you just mentioned. From 2003 to 2013, heroin-related overdose deaths nationwide quadrupled. And the Sauk Valley area was not immune to this. We saw a significant increase in opioid overdose deaths. There was a medical provider in the area who was shut down by the DEA. Because he was overprescribing individuals pain medications. And so when he was shut down, unfortunately, that left many patients in the area panicking. I mean, it was panic. And so we had a lot of patients coming and seeking help from this clinic. And so at the time, we had to look at the community in general, look at the Sauk Valley area. What do we have? What don't we have? What are we able to do? Because we also had to work within our means. And so one thing that we could provide, we knew we had medical providers. We have a whole behavioral health department with a psychiatrist and a psychiatric nurse practitioner. And so MAT is what we've really focused on and started doing our research on. I mean, it was a lot of research with education, not only education for myself and the providers, but the clinic as a whole, because some of the individuals who had worked here for a long time were really traumatized by the experience that they had with individuals who were panicking because they no longer were able to get those pain medications. And in reality, I mean, they were in withdrawal. So we had to do some, sensitivity training with staff. We had to talk about stereotypes. I think even though it's 2021, there are still a lot of stereotypes about opioid use disorder. What we see is that it does not discriminate. I work with individuals who have career paths, who have families, who have support systems, and a lot of times when I'm talking to people about the opioid epidemic, it's right to that thought of heroin and no support system and homelessness. And that's just not the truth. While at times that is the reality of individuals, it's not the reality for everyone. So that's when we really started. We knew we had to do something. We are a public health department. This was our crisis, and we needed to engage the community with what we had. And so, we got providers to get their X waiver. We started looking at our workflow here and how we could develop a MAT program. And we also decided that we wanted our MAT program to be very behavioral health led. And we wanted to work with these individuals, not just on with the medications and the substance use disorder, but we wanted to work on those underlying mental health symptoms like anxiety, depression, bipolar disorder, PTSD. And so we knew that was really important to us. And so we ended up serving our first patient in March of 2016. And I'll tell you this, every day is a learning experience. I'm still learning. I think I can speak for Dr. Smith and say that she's still learning. There's something new every day that comes up. And I'm just so blessed that we have such a great team here, and we put our minds together and try to problem solve and do what's best for the individual patient in that moment.
That was excellent needs, and that just kind of shows how the funding and the needs assessments that communities do on a regular basis help dictate what we work on and how we develop programs, and just addressing what the community is saying and what they need. I wanted to give the group a little bit of background. Project Open is a tri-county grant. We're in Lee, Ogle, Whiteside County. Whiteside County had their established program, and they were serving a number of patients, and we'll get into the data in here and kind of share those successes. But part of Project Open's goal was to expand MAT into Lee and Ogle County to have services for those populations. We were successful in that expansion, and Whitney will give some background on that. But when we were doing the research, when our provider and treatment champion group team was doing the research, we talked to so many different MAT providers across the state, and even in Indiana and Wisconsin, and no two programs were the same. Every program had a little bit of different nuances. It was really fun to learn that and their philosophies behind that. And so, I kind of want to talk to you guys about your treatment approach and what your guys' philosophies are that you believe are successful.
Absolutely. I will speak from personal experience. It was hard because I'm a rule follower. So I wanted to, do it step by step. And that's just not how MAT is. As you said, every clinic does it a little bit different. Of course, there are best practice guidelines from HRSA or from the state of Illinois or whatever state you're in. there are best practice guidelines, but you have to kind of navigate what works for you. And so, we knew that we wanted to focus holistically on the patient. And as Dr. Smith mentioned earlier, this wasn't just about MAT. This wasn't just about medications. This was about trauma, mental health, medical assistance. We have patients who have not had a primary care physician at all, ever. Dental care. Some of our patients were in serious need of dental care, housing, transportation, insurance. It could go on and on, but it was so important to us to address all of those things because we know that for long-term recovery that people need stable housing, right? They need a safe environment to live. They need to feel good about themselves. So getting them in for that dental care appointment can be so important. And I think giving the patient options as far as, when we have our patients meet with Dr. Smith or one of our other providers, they talk about treatment options, what medications they can try or what is available to them. And they determine with their provider, which allows a patient to really be in control of their treatment altogether. So I think that's really important as well.
Dr. Smith, did you have anything to add as to, you appear to have a lot of experience working in different places. Was Whiteside County the first one you did an MAT at?
Yeah, Whiteside County was my first MAT experience. I primarily did a lot of women's health prior to that, but it doesn't matter, honestly, where your background is. This is out there everywhere. So regardless of, family practice, a lot of OB-GYNs see it. It is definitely everywhere. So it's something I knew about before I came to Whiteside County. So it was really nice when I came here, they were developing this program and to be part of it and to give patients those options that, I wasn't able to provide for them before. And I think it's one of those things that initially providers probably, are a little nervous about. The training definitely helps because it gives you a lot of background and a lot of, research and different things in that. But I agree with Whitney. You learn things from those patients every day. Things sometimes you're like, I had no idea, where you were coming from. So it gives you a different perspective and a different outlook on that to be able to sometimes better help the patient when they're open with you like that, to make better treatment options with them for them.
Thank you for that feedback. I'm a data nerd. I know there's probably a lot of data nerds out there. Since you guys have started it, this is the time to humble brag now. How many patients have you served? How many people have been successful in the program? How many active people do you have using the program? And,
Sure. So we've served over 300 patients, and we average a 46% success rate, which is amazing in the world of substance use disorder. And I have to give kudos to my team and my patients for that. And we are currently have 100 active patients, and we most recently expanded into Lee County, as Aaqil had mentioned, which we're so excited about. We started our program over there July 8th, and so we're slowly building our patients over there. And while some people who are familiar on this are familiar with the distance between Whiteside and Lee counties might not see it as a big deal. That is a huge barrier for our patients. I mean, transportation in the rural communities, especially with COVID and the changes in the rules for public transportation, we are able to assist patients with being in 2 locations and within walking distance of most of our patients in downtown Dixon. So we're so excited about that. Some other barriers that I did want to mention, because I think it's important too for those on this call who want to develop an MAT program, is to think about what barriers your patients may face and then try to problem solve and come up with some ways to get over those barriers. Because I'm telling you, if a patient continuously runs into a barrier, they will fall out of the program, unfortunately, because it's just self-defeating at that point in time. So for us, it was the transportation, paying for prescriptions. Of course, COVID got thrown in there. And so we're constantly looking at grants. We're looking at resources. We have been rewarded with grants, and we're able to get gift cards for our patients for their prescriptions. So we've worked with, some of the big pharmacies in the area in order to be able to do that. Transportation, we've gotten some numbers from local taxi companies. So if we're ever in a bind, we can call them and try to get them here. Gas cards, giving our patients some incentives. That's also been huge in helping with that barrier. And like I said, other grants, we had every one of our patients gets Narcan here. And if those who aren't familiar with Narcan, it's the opioid overdose reversal medication. And we hand out Narcan. So even if you don't want treatment, you can come in and get that Narcan. You can also get Narcan at any pharmacy with no prescription needed. So Walgreens, CVS's, Walmart, all of them should be able to provide individuals with Narcan. Something I mentioned before, but I want to say it again for those on this call who are thinking about developing an MAT program, is I think it's so important before you just start doing it within your clinic to really do a sensitivity training for all employees. And that means, when I say all employees, I mean everybody, from that front person that individual is going to experience when they walk in and check in for the day, to the security guard on site, to the janitors on site, everyone, just to give some education so that individuals are aware of what patients may be experiencing, breaking some of those stereotypes, and just making sure that you have a good supportive staff who is ready to help this population. Because if not, like I said, that patient runs into that barrier the first time that they walk in and they don't feel accepted into the clinic, or there is any hesitation, you might not ever get the chance to help that individual again.
Yeah, and I just want to add a little bit as an MAT provider that I've had patients in the MAT program who come see me as their primary care provider who are no longer in the MAT program, and they've been successful. And now, I get to provide their medical care. And that is, as a provider, that is super rewarding as a provider to see your patients do well. And I mean, in anything, but especially in something that can be this difficult and have so many social aspects to it as well. So again, if you're thinking about, how will this affect my practice as a provider or something like that, it can truly have some big rewards long term.
Absolutely.
Thanks for that, Dr. Smith. And you talked about it just recently, right? Being able to treat patients, the successes, watching them succeed. I think now's a good time to introduce our special guest that we brought on the call today, and I appreciate you guys being able to facilitate this. And so, we'd like to introduce and welcome Katie to the broadcast. Katie, if you don't mind, giving a little bit of introduction, who you are, and a little bit of background about your story.
Sure. Well, hello, my name is Katie, and I'm an opioid addict currently in recovery with Whitney and her team at the Whiteside County Health Department, or the MAP program. So a little background, I had my first dose of narcotics at 17, and it was for legit purposes. In fact, most of my opioid use at the start anyway was for valid reasons. Since 17, I've had numerous health issues: endometriosis, fibromyalgia, blood clots, exploratory surgeries, et cetera, et cetera. I've been referred to every kind of specialist, GI, cardiovascular. I've been to Mayo Clinic twice. And I started seeing my first pain specialist in my early 20s, and I was wearing fentanyl patches and taking 325 Norcos early in my adulthood. Later in my 20s, I got pregnant, and I worked with my doctors, got off the pain medicine, and had a very uneventful pregnancy with my daughter, Gracie. When her due date arrived in August, I remember just feeling off. Not bad, just weird. So my mom took me to the emergency room, thinking perhaps I was starting labor. I'll never forget the look on the doctor's face when she told me Gracie had died the night prior, an umbilical cord accident. Nor will I forget the doctor's next comment to the nursing staff when she said, "I don't want her to feel anything when she delivers this baby. Anything she needs, you give it to her." So the night I delivered my daughter was probably my most hallucinatory trip ever. Anytime I had any cramping or discomfort at all, the nurses were there putting more and more medicines in my IV. And because of the drugs, I hallucinated that my friends materialized out of the television, and my family was floating in and out of the windows. And all of this was happening while I delivered my daughter, who had died. I don't recall much from the years after Gracie's death. I remember waking up in the morning and reaching for the Xanax or the Valium next to my bed, one or the other. Or maybe some mornings I took both and just went back to sleep. Again, I don't remember much. I was fortunate these years, as I was able to move back in with my mother, and she did all she could to help me. My doctor thought it was a good idea to refer me to a psychiatrist for my depression over my daughter. The second time I saw him, I remember complaining of how tired I was, probably because of my deep depression. But instead of antidepressants, he prescribed me 60 milligrams of Adderall a day for fatigue. He said it would help with a bit of the weight loss too, which would probably make me feel better. But then I couldn't sleep. So on the next visit, he prescribed me 1 to 2 milligrams of Ativan at night to counter the effects of the Adderall during the day. Soon after, the pain of the endometriosis and the fibromyalgia returned, and I found myself right back to the pain specialist with my extra strength Norcos 3 times a day. My early 30s saw an increase in my dependence of all my meds. The Adderall, the Ativan were increased. I started taking other opioids for breakthrough pain. I had a pill organizer to help me throughout my day, but then the months started getting longer and my pill supply shorter. I started taking more of my meds than prescribed and would run out before the end of the month. I started stealing meds from family and asking friends for favors. And when I couldn't find pills, I started turning to recreational drugs, the cocaine, marijuana, alcohol. The astonishing thing about this period of my life is that somehow I managed to figure out what I wanted to do. I remember the specific nurse when I delivered Gracie. She seemed so together, so confident, and I wanted that. I wanted that for my life. So I took classes to become a certified nursing assistant. I got a job at the local hospital and worked for 5 years as a CNA. And life was good. I got married, bought a house, got pregnant, and off the pills again. And delivered a very healthy, very large baby boy after a very stressful pregnancy. But then life happened, and my son's father and I decided to get a divorce. And I soon found myself back at my mother's house with a baby, trying to figure things out. Since I again had family support, I decided to continue my schooling to be a nurse. I also revisited my psychiatrist, and the Adderall and Ativan started again without question. I graduated nursing school, one of the top 2 in my class, and I began work as a nurse on the same floor I had spent as a CNA. I spent time with a childhood friend after his mother passed away. We began to date, and soon after I was remarried. But again, my health began to fail. I found myself hospitalized numerous times for pain management. The doctors kept recommending a hysterectomy, but I kept refusing as I wanted more children. But the scripts for pain meds kept coming, and when I couldn't get scripts for pain meds, I again borrowed from family and asked favors for friends. And even if I didn't have pain meds, I still had my Adderall, my Ativan, or marijuana, or cocaine, or alcohol. After the numerous hospitalizations and missing work and missing out on life, I finally agreed to a hysterectomy. My surgery was done locally, but after I was discharged, troubles arose when my toes started turning black. The pain in my feet and legs was intense. I ended up back in another emergency room, but this time with an ambulance transferred to a larger hospital. I spent a week in a hospital up there on a heparin drip for more blood clots and around-the-clock IV pain meds. I wasn't able to walk for 3 days due to the pain in my legs. And on discharge, I was given a month-long script for narcotics that did not last the month. I was able to get a decent number of pills from a friend who had surgery, but no longer needed her 90-plus Norcos any longer. Instead of taking time to work on my health, I thought it better if I returned to work. I thought maybe if I went back, I wouldn't fret so much about the pain in my legs and my dwindling amount of pain meds. Keep in mind that I could barely walk due to the pain in my legs and feet. But family members kept telling me to get back to life. Work helps by keeping your mind busy and off your troubles. 2 weeks. That's how long it took me being back at work before I accidentally came home with a morphine cartridge in my pocket that I had failed to waste at work. The few times prior that this had happened, I would get in my car and return it whatever it was to work ASAP. No way was I getting in trouble for mistakenly bringing something like that home. But this time I remember standing in my bathroom, looking at myself in the mirror and thinking, I just want to feel better. That's it. That's all I want, just to feel better. I had morphine. I had needles. It was flu season and we were giving flu shots left and right. So I had a few new needles in my possession, and I had the knowledge. I'm a nurse. I know how to start IVs and give pain meds. I remember the feeling of relief after giving myself the morphine in my bathroom that day. Even now, I can remember the feeling of weightlessness in my legs, how the heaviness in my body just disappeared, how I just felt better. Overall, I felt so much better. And I promised myself that day this would be a one-time thing. Never again would this happen. Never. The emptiest feelings of addiction occur when you continuously promise yourself that you will never, ever again use, but find yourself using again in no time. And that's what happened to me. 3 months of diverting leftover narcotics, 3 months of stealing wasted narcotics from the so-called locked waste container at work, 3 months of putting needles in my arm, at first at home, then in my car, and towards the end, even at the bathrooms at work. Throughout these 3 months of IV drug use, I would wake up every morning at 2:30 a.m., without fail, every morning. I would lay awake thinking of how the amount of fentanyl I was using was going to kill me, thinking of my son growing up without his mom, thinking of my husband who had tragically just lost his mom a short time before. And I would promise myself I would not use again. And I would break that promise every morning when I went to work. When it was finally discovered that I was diverting waste for personal use, I was terrified. Terrified of getting in trouble, losing my nursing license, losing my family, my husband, my son. But with that terror, there was a thankfulness. Finally, someone had discovered me. Finally, I could stop this cycle of stealing and sticking needles in my arms. I came up with some lame-ass excuse of how I wouldn't subject to a suspicious drug test because I knew I would fail for marijuana. Yes, I would fail for marijuana, but also for cocaine, Dilaudid, morphine, fentanyl, Norco, Oxy, etc. So I nicely thanked the directors for my job, shook hands with the HR lady, cleaned out my locker, and left. Almost 10 years at my job, and I walked out like it was nothing. My heart did break for everything I was walking away from, but there was a part of me that realized if I didn't walk away, my heart would probably stop from the excessive drug use. When my husband discovered what I had been doing, he understandably went crazy. He blamed himself and wondered why he hadn't discovered the numerous needle marks on my arms. I had excuses for the last 3 months and why I always wore long sleeve shirts. My recent surgery made me cold all the time. Maybe it was a leftover effect of the blood clots or new medicines. I had an excuse for it all. Us addicts are good at excuses. My husband threatened to take my son and leave. He threatened to put me in rehab. Lots of tears and promises were the only ways I was able to stay home. I stupidly told him and the rest of my family that this was no big deal. I could handle this. I kept repeating this almost like a mantra of, it's no big deal, it's no big deal. The lies us addicts tell to make everyone, ourselves included, feel better. My husband started making phone calls in the area for help. We knew I needed some kind of assistance, but I just thought maybe I needed a new doctor, or maybe I could go back to my pain specialist, maybe my psychiatrist. But he called places like Mississippi, like places that work with addicts. And at this point, I was still in denial about being an addict. After numerous phone calls in the area, he was directed to the Medically Assisted Treatment Program, or the MAT program, at Whiteside County Health Department. After speaking with the Whiteside County Health Department, we found that they could help me, but I had to be 24 hours free of opioid use. And here's the catch. It was Memorial Day weekend. We were calling on the Thursday before. They couldn't get us in until the first thing Tuesday morning. I resigned from my job on a Wednesday, and I had enough narcotics hidden away so that my last dose of anything was Thursday night. From Friday until Monday, I detoxed at home. We had sent our son off to be with his grandparents for 5 days. I thought that this was a bit excessive at the time, but I'm so thankful now that he was not in the home during this time. When people ask if I ever think I will ever do drugs again, I can honestly tell them no. Detoxing at home was the worst single event of my life, and this is coming from someone who has had a child die. I hallucinated I was in hell. I saw Satan. I became homicidal, suicidal, and delusional over and over and over and over again. I smelled my skin burning. That's how messed up my detoxing was. I smelled my skin burning, but nothing was there. I didn't come out of detox with 3rd-degree burns, but I did come out feeling like absolute shit. Like I'd been hit by a truck, dropped out of a plane, and left for dead. And I pleaded with my husband over and over again to take me to the hospital, but he wouldn't, and it was pure torture. On top of it all, he expected me to get up on Tuesday and go to this godforsaken place with stupid rules and stupid sober people. My attitude was seriously like a teenage girl at that point, and I wanted to pull a blanket over my head and scream and stomp my feet. It didn't even register in my mind what he had been going through during this time, the hours he spent on the phone trying to get me help, the arrangements he made with his job, with my family, with his family, etc. Because as you know, addict behavior centers on selfishness, and I was the epitome of selfishness at this time. I remember walking into Whitney's office at the Whiteside County Health Department. My chin was so low that it rested on my chest. I had zero confidence in myself. I looked and felt like garbage. And if I remember right, I think I threw up in the parking lot right before we came through the door. My husband and I sat in Whitney's office for over an hour while she peppered me with questions on my drug use. The pills, the pain specialist, the Adderall, the Ativan, the needles, everything. Saying out loud to her was rather eye-opening. Even in my ears, it sounded quite excessive. I went through the rest of the registration process, pouting. I just wanted to go home. I couldn't figure out why I was here, but they kept telling me they were going to give me medicine to help me make me feel better. And as if nothing was helping this feeling. After what felt like an eternity, my husband and I were able to pick up a script for Suboxone from the local pharmacy. I had no knowledge of this medicine, but taking it did alleviate my symptoms. I did not feel great, but after my first dose, I felt a little more human. I was given a script for a few days and told that I had come back for a group meeting later that week. Meeting with my first group was, honestly, I couldn't tell you what it's like. I forgot I know I just showed up in sweatpants looking like I had just rolled out of bed, probably because I had. I think I just sat there. I didn't have anything to share with these addicts. But the second week I came back, and the third, and finally I started sharing. And the same thing happened with my counselor that we were assigned to meet with weekly. I did not have anything to share with her, but then she got me talking about my past, about Gracie, and I found myself sharing a bit more each week. My Suboxone strips, however, became problematic. If taking one made me feel better, would taking two or more make me feel great? This line of thinking did not last long, however. Bless my husband for sticking my meds in a locked safe and only giving me my prescribed amount for the day. It became a point of contention between us, especially when I acted like a bratty teenager, wanting to take more and more. Time progressed, and the struggles that came with sobering up came with. I was turned into the nursing board for diversion. My 3-year probation from the nursing board will end in March of 2022, but my license will forever be marred with a tiny caption that says, yes, she has been reprimanded, and this is for failing to submit to a suspicious drug test after possible narcotic diversion. I cannot work as a bedside nurse anymore. It would be like a recovering alcoholic working as a bartender. Instead, I've found a job that I absolutely adore, teaching CNAs. This gives me the best of patient care, but without the handling of narcotics. I continue to meet with weekly groups, and before too long, I started attending other area recovery groups. In these groups, I made friends. I started chairing groups, and then I started becoming involved in the Voices of Recovery group and worked on their newsletter. And I found that I actually liked this, and I liked the people that I met. With 3 years and 3 months, that's how long I've been sober from opioids. I've continued with the Suboxone use. Yes, I see it as a crutch, but it's a crutch that I'm slowly doing away with. My amount has cut down 3 times, and I plan on cutting down again at the end of summer so that I'm able to quit completely by the time next year rolls around. I want to be done with the Suboxone and my probation at approximately the same time. A while ago, my director at work offered me another class to teach and more responsibilities, accompanying the current classes we have together, and I happily agreed. But then I went home and fretted as I knew I needed to tell her of my past. I did not want her putting more faith into me, whereas I couldn't put faith into her by telling her my dirty little secrets. So I scripted what I wanted to say to her, and I practiced with my counselor. I lost sleep, I cried, I started looking for other jobs. And then I told her, and she thanked me for trusting her enough to share, thanked me for letting her know that I was going through and that if I needed anything or if she could make my journey easier in any way, I just needed to let her know. My husband and I worked out a system where I started having more and more access to my Suboxone strips. We started with 2 days, increased to 3, then 5. There was a lot of mistakes on my part, but he wouldn't budge or give me any sooner if I took too many. And here today, I sit with access to an entire month's supply, and I know I do not need to take more than the prescribed amount. Better yet, I'll go an entire afternoon before I remember that I forgot to take my morning strip. Whiteside County's MAP program was an absolute pain with all of these hoops to jump through, weekly drug tests, turn in your empty strips, go to meetings, see your counselor, etc. I am thankful they were a pain, though, because I honestly do credit them with saving my life, as does my husband. When I told him I'd be talking to you all today, I asked if he had anything I should add. His words, the MAP program saved your life. And after 13 years, I can honor my daughter, Gracie, by talking about her without crying. And I have my counselors at Whiteside County to thank for that. Also, I used what I learned in group and for my counselors to quit smoking cigarettes, a nasty habit I picked up when I was 16. This week, it's been 18 months since I've had my last cigarette, and I never thought I'd be able to say that I don't smoke. As a side, I wish in nursing school we were screened for substance use disorders. I don't recall any lesson about how nurses are 10 to 15% more likely to have addiction than the general public. And never once did someone say to me, be careful if you have a substance use disorder because someday you'll come home with narcotics in your pocket and it'll be a complete accident. And if only I'd known then. Thank you.
Thanks for sharing, Katie. That was amazing.
I think I can speak for a lot of us that there's no way that you can listen to that and have a dry eye. And the part that really stood out to me, Katie, that I think you emphasized was the fact that the substance use started off totally accurately and honestly, right?
Yep.
At the early stages of Project Open, there was a lot of biases about, this is, underground drugs, this is, black market drugs, but almost half of the respondents that we surveyed through our key informant survey identified as getting their initial prescription through their doctor's office. And then from there, it just sprouted. I think you gave us an amazing depiction and story with respect to how that kind of just snowballed, the amount of effort and willpower you had throughout the process, but just life happens. There's just things that are sometimes out of your control that send you down sometimes a dark path. And so, Whitney and Dr. Smith, I wanted to ask you guys, based off Katie's story, is this kind of what you guys hear often, or how much of Katie's story is what you live on a day-to-day basis?
Without running actual data, because I see every single patient that's ever been treated in our MAP program, off the top of my head, I can tell you that 85% or more of our patients have a similar story to Katie's, where there are some underlying mental health issues or traumatic events. And at that right time, a prescription gets written for legit pain, a tooth being removed or a surgery, something where pain medication was needed, and then prescription was written and just got out of control and spiraled. And like Katie said, we see our patients who have a career or are married, children, and slowly but surely things start to snowball and cycle out of control, and they're losing everything that they have.
I mean, Katie, I primarily want to thank you. I know when we were planning this session, we had talked about a lived experience testimonial and the reality of that. And so the amount of courage and bravery I think it took for you to share your story, I can't thank you enough for that. And I do have to commend you on the newsletter for Sauk Valley Voices of Recovery. That product is it gets better and better. I don't think it's possible, but it keeps getting better and better. And so for those listening, svvor.org is our local recovery community organization, which Katie's now involved in. You said it, MAT saved your life, or rather your husband said that. And so just talking about the future, you plan to be able to graduate from that program pretty soon. And then because of the program, you think, life plans, now you're able to actually honor your daughter and have those life plans. So, is there anything else you wanted to add, Katie, with respect to the MAT program and kind of your current state and next steps?
It's a lot of work. It definitely is a lot of work being in this program, but it's you just think about it. It's like, okay, this is what you have to do in order to be, I don't know. And when I was growing up and I was taking all these pills, I would look around and I would think, how do other people get through their days without pills? And it never dawned on me that that's how life is supposed to be. You're supposed to be able to go from sun up to sundown without taking a handful of pills. And I would look at my friends and I would say, how do they do that without? But MAT has taught me that, you're supposed to live your life without a handful of pills a day. That's how sobriety is, how you're supposed to live your life. And it's so much better when you're sober. It's so much. I don't lie. I don't have this constant worry that I'm going to run out of pills. I can look at people and talk to them and be confident in the fact that what I'm saying to them is 110% the truth, because I spent so much of my life lying that it's just astounding where I've been and where I've come from. And sometimes I think I look back on my life and I'm like, that wasn't my life. That wasn't, but it was. I have it all there. I have the testimonial. I can write everything down and I can say, this is where I was at. And now here I am. And it wouldn't have been that way without the MAT program and without Whitney and everybody else. And the team is amazing. And they just do such wonderful work. And all of them have this patience that is just amazing to me. I think if I was constantly dealing with all of these people that were complaining about all these things, I probably would reach a limit there. But Whitney and her team never do. They never seem to reach any kind of, they're a great group of people to work with. And again, I have them to thank for my success. That's it.
My last question to you, Katie, before we sign off: if someone's listening to this broadcast right now and they're actively using, what would be your advice to them?
Call Whitney. call somebody. I mean, and that's the thing too, is that I kept saying, I can do this by myself. This is no big deal. I've got this, and then all of a sudden it was a big deal. And I was detoxing at home, and I was sicker than sick, and I was going through all of this stuff. And I just, trying to tell yourself it's no big deal is just a lie, another lie that you're telling, because it is a big deal. It is. And it doesn't, I don't know, there was such this feeling that I was bad because this happened to me, that I was not as good as anybody else because I had this problem. And so going to the MAP program made me realize that it's something that can happen to anybody. It's something that can happen to anybody. It doesn't matter what your education is or where you come from or who you are. It's like Whitney said, you can go have a tooth pulled and get a script for pain meds and end up, on heroin, because I knew that was my next step. I knew as soon as, and my husband said that too. He goes, if we don't get you help, you're going to end up on heroin. And that's just what's going to happen. And so thankfully we were able to get into the MAP program, and here I am 3 years later. So.
And I just would like to add that, if somebody is out there watching this today and they're unsure if MAT is for them, just like Katie said, give us a call, walk through the door. I'm happy to meet with you, talk to you for 5 minutes. And, and if it's not, and if this isn't the route that you want to go, because definitely it's not for everybody. That's why there's treatment options. I would be more than happy to point in a different direction and give that individual different resources. Or like I said, at least hand out Narcan. And if you don't need it, come in and get it for your friend, cousin, family member, whoever might need it.
Thanks for that. Dr. Smith, anything to add before we sign off?
No, it's, this is a good program. Katie did a fantastic job, and we're here to serve our community. That's our goal, and that's our job.
Well, thank you guys. My name is Aaqil Khan, Director of Project Open, which is a Tri-County grant. You heard about a wonderful program here today, MAT at Whiteside County Community Health Clinic. They're now in Lee County. There's also another MAT program in Lee County and Ogle County. Mississippi Centers has got a program as well. So we understand there's different philosophies, there's different groups. Whitney and that team work very closely with the Mississippi team to ensure the patient is at the center of care and they get the best treatment they need. And you heard the tagline for the day, MAT saved my life. Thank you, Katie, for everything you do. Whitney and Dr. Smith, appreciate you guys' time today. And thanks for tuning into Tuesday Talk. We'll talk to you guys next week. Thank you.
Thank you.